First five Sacramento Commission meeting for February 7th, 2022. Madam Clerk, will you please call the roll and establish a quorum?
Yes, sir. Chair Cerna.
Here.
Commissioner Sneeringer.
Here.
Commissioner Fernandez y Garcia.
Here.
Commissioner Gordon.
Here.
Commissioner Casirier has not popped in yet. Commissioner Wagstaff.
Here.
Commissioner Works.
Here.
Okay. Commissioner Kennedy. Haven't seen him. Commissioner Hassett.
Here.
Commissioner Turner Johnson. You know, do we think this Richard Johnson Jr. might be Lee Turner Johnson?
Yeah, I think it's possible.
Okay, I'm gonna let that person in and we'll double check. Commissioner Evans. I don't see her. And Commissioner Kathari is not in. And Commissioner Moak.
Here.
Okay. We have a quorum.
Great, thank you. Steph, if you could give us the image of the flag, please. We'll do the pledge.
There you are.
If you would please join me in the pledge. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right, thank you. Okay, again, I'd like to welcome everyone to today's first five Sacramento Commission. It's our meeting for February of 2022. I do have some announcements to make in terms of the rules of engagement, so to speak, in this remote environment that we still find ourselves in. First of all, we do have rules for commissioners, and they are as follows. Commissioners will be unmuted upon entering the Zoom meeting, and I ask that you mute yourself until you are called on to speak. Commissioners are encouraged to make comments and ask questions of staff throughout the meeting. Please use your raise hand button under participants when you would like to speak, and I will call on you in order. Please lower your raised hand after you have been called on. Commissioners may see some questions pop up in the Q&A section. Please allow staff to answer those questions as they will primarily be related to making public comment. And of course, we always welcome members of the public to contribute and participate in our meetings. For members of the public, we ask when you're entering the room, we note that you'd have the ability to signal that you'd like to make a comment on any agenda item throughout the meeting. To be placed on the speakers list for any item, please click on the Q&A button and write your name and indicate the agenda item you wish to speak on. Please type into the Q&A at the beginning of the meeting or as soon as you know you would like to comment so that staff have time to create the speakers list. We will call your name in the order it was received and unmute you when it's your time to speak. The public calling in through the phone line will also have an opportunity to address the commission. If you have something to say when the phone line is unmuted, please state your name, the agenda item you wish to address, and then your comment. Public comment in the Zoom meeting or over the phone is limited to 3 minutes so that everyone can address the commission if they so choose. All right. And with that, I believe, Steph, you want to give the Metro Cable playback statement?
Okay. This meeting of the first five Sacramento Commission is cablecast live on Metro Cable 14, the local government affairs channel on the Comcast, Consolidated Communications, and AT&T Uverse cable systems. This meeting is post-captioned and live streamed at metro14live.saccounty.gov. Today's meeting will be repeated Wednesday, February 9th at 9:00 p.m. on channel 14. This meeting can also be viewed at youtube.com/metrocable14.
Great, thank you. All right, I know we all have very busy schedules, so we'll get right to our order of business today. First item on our consent calendar this afternoon is approval of the November 1st, 2021 draft action summary. Does any commissioner wish to pull the item for any corrections, additions, deletions? If not, I'd entertain a motion, assuming we have no public comment on the item.
So moved, Mr. Chair.
Okay, it's been moved by Commissioner Wagstaff,
I'll second.
second by Commissioner Skiringer. And Madam Clerk, no public comment, I assume?
No, sir.
Okay, roll call vote, please.
Chair Serna.
Aye.
Commissioner Swearinger.
Aye.
Commissioner Fernandez y Garcia.
Aye.
Commissioner Gordon.
Aye.
Commissioner Wagstaff.
Aye.
Commissioner Wertz.
Aye.
Thank you. Motion passes.
Great, thank you very much. Okay, we'll move on to separate matters. The next item is the public's opportunity to address the commission on items not on the agenda. Madam Clerk, do we have anyone in the waiting room that wishes to address the commission on items not on our agenda?
No, we do not.
Okay, thank you very much. With that, we'll move on to item 3, which is the executive director's report.
Thank you, Chair Serna. Wonderful to see so many of your faces today. I have a couple of interesting items on the executive director's report to share with you. I'm going to start with really good news. At our last meeting, I had informed you that there was a reduction to our CalWorks home visiting grant, and that is the grant that funds a pretty large part of our Birth and Beyond program. So I'm pleased today to announce that the Department of Human Assistance found a way to backfill that $900,000 reduction to Birth and Beyond, should they need the funding. As you may recall, this reduction came as a big surprise. We were not expecting it. It would have resulted in some layoffs through Birth and Beyond and possibly even establishing a wait list. So, so while that is excellent news, I just also wanted to note, and I'll talk about it later in the ED report, the governor's proposed budget came out last month, and it looks like it is not increasing that CalWorks home visiting program back to its full funded place, at least not in this version, not in this initial version of the agenda. So we'll have to see what happens in the May revise. We will certainly be advocating in our various through our various associations to make that happen. And we'll see what happens in the May revise. I did just want to give a shout out of thanks to Commissioner Wagstaff for his leadership on this and working with Ethan Dye from Department of Human Assistance to find the solution to make it work for this fiscal year. It's definitely a team effort to ensure that those services would continue without interruption. So thank you. Moving on to other really good news too. First, I partnered with the Department of Child, Family, and Adult Services to request ARPA funding that would implement a new program called Building Strong Families. And last month, Chair Serna and the Board of Supervisors approved funding in the amount of $3.9 million over the next 2.5 years. And First Five and Child, Family, and Adult Services will contract this money out to community-based agencies to hire what we're calling family support navigators. And those navigators would connect stressed families in the communities that are hardest hit by COVID and get those families into critical services like home visiting, health and mental health services, transportation, housing, basic needs. And the funds would allow our community incubators and family resource centers to expand on their current work. They do some of this already, but it would allow them to have a dedicated staff sort of acting as a cohort of 16 family support navigators in those hotspot communities hit by COVID that could really come together as a group to help families in all of those areas. So we're super excited about it. We will be using a closed loop referral system called Unite Us that the Navigators will use to track the families that they're serving so that they can ensure that those families receive services, or they can troubleshoot barriers, solutions to barriers that come up if families are referred but don't actually get into the services. So we really expect an increase in the number of families utilizing all different kinds of services around the county as a result of the Family Support Navigators. So very exciting new partnership with Child, Family, and Adult Services, and an expansion of successful programming already. I would jump to our Afghan refugee efforts. As you know, we continue to look to see how First Five can be of use to our resettlement agencies and refugee support agencies, as well as our own contractors who are serving Afghan refugee families. In December, First Five asked our partner agencies to let us know what they needed to better serve refugee families. And nearly half of those agencies responded, said that they really they needed a connection to organizations to recruit bilingual and bicultural staff to be able to better serve their refugee families coming in the doors. So we are working with both REDA and Opening Doors and several other agencies to create a warm handoff for agencies who need staffing to those agencies that have folks who are looking for jobs. So that is exciting. And we're also bringing in Opening Doors to present at our February, at our February quarterly contractors meeting. And they will be speaking specifically around working within in a cultural responsive way with Afghan families coming through their doors. And then finally, on this topic, First Five California allocated $3 million back in October to this effort, and they are looking to contract with local First Fives who would be able to, in our case, re-grant this money, should we be awarded, out to community agencies who are doing the work to really focus on child care subsidies as well as basic needs for families. So we'll be applying for this in March. The maximum amount we can apply for is $750,000, which in a county our size and with the amount of refugees that we have, I think, we would ask for the top dollar amount, and we would then work with that with our local agencies to provide services. So I will keep you posted, but just to let you know that we're gonna try to get some First Five California money into Sacramento to do this work. Let's see, on Ready. So we are continue our centering of racial equity, diversity, and inclusion into all aspects of First Five. We're this month going to receive the summary report and recommendations from our Ready Plus Cultural Responsiveness Survey that you all participated in back in December. And we will share it out. We'll share out that report with SOS Committee and with the Advisory Committee and get their input before bringing it to the Commission in March. Additionally, last month, First Five staff met with, it's called Ready Curbside Consulting, and the First Five Association provided this curbside consulting for county First Fives who are interested in picking a topic and going deeper with a team of experts. And Latina Price coordinated this for us, and we had a 2-hour session focused on our desire to reach deeper into community and to really interact with agencies that serve diverse families that we have not previously been funded by First Five Sacramento. We know we had many agencies who applied in this last round of funding, but just didn't score high enough to get some of our dollars. And we really want to do something with those agencies to bring them on board in some way within the next strategic planning process. So we're brainstorming, we're looking at best practices, we're talking with our curbside consultants, and we're going to figure this out. And you will see these recommendations and have time to discuss them during strategic planning, which actually starts later this calendar year. What else? There's a lot going on in the Ready world. A couple, Latina and I, joined the county-sponsored Racial Equity Committee. They had a kickoff meeting on January 25th, and that was members from Department of Health Services, Department of Human Assistance, and First Five. And we're going to reach out and try to get someone from Child, Family, and Adult Services at that table too. So sort of a social services smaller group. And we're looking at things that go across all of our systems, ready issues, ready opportunities that would cross all of our systems, sharing what we're doing in our own departments, and really trying to move the ready work of the whole county forward, knowing and understanding the county's larger resolution declaring public racism as a public health crisis, and the commission's own resolution on racial justice and social equity. So keep you posted as we get deeper into that, but we're just really happy to be a part of the county's larger team working on it. And then finally, just a reminder that as part of our Ready education efforts, we are providing for staff, commissioners, and our contractors free and reduced cultural responsiveness training. And our next one is coming up February 15th, and that is an intro to cultural intelligence that Impact Foundry is hosting. So if you are at all interested in attending that, just send me an email and I will send you the registration code. Okay, next. Moving on to our evaluation update. At the October meeting, when we shared this, we had a few weeks left before we had to turn it in to the First Five California, and there was a lot of missing data. 42% of data for race and ethnicity and languages spoken was unknown. And so we followed up with our contractors in that next week, and we were able to get more information in, which did change the charts that are in the ED report. So you'll notice that while the updated data, it changed the percentages, but it didn't actually change sort of who we're serving the most of. So primarily we served Latino parents and children, followed by African American families, then white, then Asian, and then multiracial. And we served, 3/4 of the families we served were English-speaking families, followed then by Spanish-speaking families at 16%. So that data was fixed and submitted by the deadline to First Five California. I just wanted you to see it. And then stipends. So this is, I'm really proud of this work. We had some rollover dollars in our community connections grants, which the mini grants ended for community partners back in June. But we did have a little money left over, which we continue to be able to provide some mini grants. We're calling these our parent voice stipends. And we offered them to all partners in our home visiting collaborative, trying to infuse community voice into other agencies and giving them the opportunity to pay their family members a small stipend for participating in a parent advisory board that they've created, or in whatever way they saw best to bring in parent voice. And so we awarded 7 grants for this 6-month period, and then we will follow up with them. Just a series of short questions to sort of assess if those stipends did in fact bring parents to the table to share their thoughts about how the organizations were providing services. And then almost to the end here, the state updates. As you all know, I'm sure the governor's budget, proposed budget, initial budget was released last month. It definitely builds on and expands his programs for children and families. I mentioned earlier that we didn't see a return to the previous funding levels for CalWORKs home visiting, but the proposed budget did include funding to expand the California home visiting program, which in our county is the Nurse Family Partnership Grant, which is run out of Public Health Department. So we would be delighted if additional NFP dollars come into the county. And then there was also, looks like there's some additional money also within the Public Health Department to build out the or expand on Black infant health. So those are 2 programs in which potentially the county, if not first 5, would receive some additional funds. So we're happy to see that. There is a more detailed handout in your packet if you want to see by topic area what all the proposed budget entails, and then we will check back in with you during the May revise, of course. And my final update, which isn't in your report, I believe it might have come right after I sent the packet out. So the last time we were together on Zoom, I shared 2 announcements that had sort of rocked our First 5 world. The association's executive director had just resigned to move into the governor's administration. And Melissa Stafford-Jones smoothly transitioned. She's already reached out to us in Sacramento to try to bring in some parent voice to her new job. And so we still continue to keep that connection. I had also shared that Camille Mabin, longtime First 5 California executive director, announced her retirement. And so she is stepping down. This is her, I think she's stepping down at the end of March. And recruitments are going strong for both of those positions. We don't have any announcements to make yet, but really hoping soon for announcements. So that was the last meeting. And now for this meeting, I have to relay that we are going to have the loss of our First 5 California's chairperson, Dr. Nadine Burke-Harris. She's stepping down in her role as California's first Surgeon General, and because she was appointed by the governor, I believe for her work in that role, she's not in that position, then we will very likely be getting a new chairperson, which just means that there's a lot of transition going on in the leadership at First 5 at the state level. But you know what? We just continue along at the local level. We are doing the good work. We're not too ruffled by any of it. So not to worry. We will just continue and wait for things to settle out at that state level. And hopefully they get some great new energy and it will all be smooth. And with that, Chair Cerna, I am done.
All right, thank you, Julie, for that thorough report. I don't see any hands raised by commissioners. Madam Clerk, do we have any members of the public that wish to address the Executive Director's report?
No, we do not.
Okay. All right, well, thanks again, Julie, for always for your thoroughness when letting us know what is going on in and around First 5 Sacramento, and in this case, the state as well. So appreciate that. All right, we'll move on to item 4. And this is the advisory committee update. And Julie, I believe you're going to give us this report, are you not?
I believe I am. I was just going to check in with my team to see if Bob Silva is on anywhere. If he is not, I am prepared to give the report.
He is not online.
Okay, great. So we met on November 12th, and we kicked off our meeting with an introduction, one of our first meet and greets with Commissioner Fernandez y Garcia, who shared with the group. They asked him a lot of questions. I promised him 10 minutes. I think they kept him for like 20 or longer, but thank you for being a good sport, Commissioner Fernandez y Garcia. I appreciate that. And then we approved updates to our bylaws. This is the first time since I have been here that we updated our committee bylaws. We added the SOS committee as a standing committee with 2 members to be appointed to serve on it. And then we also added language to reflect the available stipend that the commission had approved for community members who participate on the advisory committee. And we added language to appoint alternate members. They really liked the fact that the commission had alternate members so that we could, make sure we have quorum. And because we sometimes have issues with quorum on those subcommittees, we got volunteers. And so now we have 2 appointed members and 2 alternate members for each committee. And then they received an update on the Ready Action Plan and the feedback from the commission meeting on the plan and the survey. That went very smoothly. And then we ended the meeting with a meet and greet with Patrick Hume, and he's the District 5 supervisorial candidate. They had lots of questions regarding his stand, his opinion on child and family related issues in District 5. So it was really great to see them interact in a new way for them with appointed with political candidates. So our next meeting is February 18th. That's all.
Great, thank you. Any questions from commissioners about the advisory committee report? Do not see any hands raised. Madam Clerk, any members of the public wish to address this item?
We do not have anybody signed up to speak here.
Great, thank you. All right, moving right along. Next on our agenda is the evaluation committee update. Commissioner Wirtz.
Thank you, Commissioner Cerna. We met, the evaluation committee met on January 24th, but even before we meet, we continue to provide input to staff in between meetings. And we did that with the Reducing African American Child Death report that you're going to hear more about. But our meeting on the 24th focused on hearing a little bit about the dashboards, which I think Julie's been sending out some notices for commissioners and public to look at. It provides some of the information that come from the evaluation report, so a useful tool for the public. And then we spent the bulk of the time after hearing from applied survey research on current activities. We spent the time reviewing the annual evaluation report for 2020 through 2021, which you will hear more about at the next meeting. So we're always ahead of schedule, hopefully, with the input from the evaluation committee. And again, I just am always impressed with the level of discussion from all of our members on the committee around input into the evaluation reports. And I think the committee continues to provide useful information to to hopefully improve the quality of the reports. And again, I've been pleased not only, as always, with First Five staff, but with the applied survey research team willingness to listen and interact with us to improve those reports. So thanks to all of them. And I think other than that, we just carried out regular business regarding, for example, the teleconferencing, remote teleconferencing meeting requirement and so on. So with that, that's my report, unless any other members of the committee would like to add anything.
All right, thank you. Any Other committee members wish to add anything? Or commissioners that might have questions? Not seeing any hands raised. Madam Clerk, any members of the public wish to address the evaluation report?
We do not have anybody signed up to speak.
Right. Thank you very much, Commissioner Wirtz. We will now move on to item 6, which is the Financial Planning Committee update. And I believe Commissioner Hassett is going to give this report.
Yes, I do. Thank you very much. So the Financial Planning Committee met on January 20th and established a quorum. We began by welcoming Scott Moak as our newest member. He's replacing the retired Kathy Kosick. We then entertained nominations and held elections for a new chairperson and a vice chair for the committee. I overwhelmingly got the popular vote, and I'm now the new chair.
No electoral college fiasco?
No, there were no fiascos. Silvio Rodriguez was elected as the vice chair. Staff updated the committee on the new policy and procedure letter that was issued by the state, and it's going to require clients to be entered into a state database system that will check for Medi-Cal eligibility and produce an actual client count for reimbursement in the claiming process. It will only search data that's less than 12 months old, which will impact the oldest 2 quarters of claims. Instead of using an actual client count for these claims, an average client count will have to be used. I did not even understand what this meant. So we may need to get clarification. The average client count will typically reduce the number of clients, which will lower our overall Medi-Cal claim amount. So I think our sense is that that's just for now, but once it gets rolling, right, Eric, it won't affect us in the future.
He showed a thumbs up.
That's correct.
Okay. Also, some good news for the CalWorks Home Visiting Program. And you already heard from Julie that we were able to secure a commitment from the Department of Human Assistance to use some other CalWorks program funding to replace the funds that are being cut in that program. Additionally, there's a joint effort by First Five and the Department of Child, Family, and Adult Services, and they've secured American Rescue Plan Act funding for an initiative called Building Stronger Families. And Julie already talked a bit about that. So it'll place family support navigators at the family resource centers and assist in removing barriers. Staff gave a presentation on how revenues are forecasted by discussing the techniques used and the impacts of variations, and presented all kinds of formulas that they use to calculate those forecasts, which was very interesting. Figures were provided for Proposition 10 revenue estimates through the next strategic plan period. And financial statements for the second quarter were reviewed, and an explanation of the staff report was provided so committee members could better understand its correlation with the financial reports. We had no further comments, and that concludes my report.
Great. Thank you, Commissioner Hassett. Any questions for Beth from commissioners? Not seeing any. Madam Clerk, do we have any members of the public that wish to address the Financial Planning Committee update?
We do not have anybody signed up to speak on this item.
Very good. Thank you. And then our final report from our committees is Commissioner Dr. Eric Fernandez y Garcia with the Systems Optimization and Sustainability Committee update.
Okay, thank you. So we held our regularly scheduled meeting around 3 months ago on November 19th, 2021. We started off by discussing some committee business around our meeting time and decided to change the meeting time to 12 to 1:30 p.m. while maintaining the same schedule of dates. We then reviewed and approved the 2022 policy priorities, which are on our agenda today for our commission's approval. We reviewed a draft of the fiscal year 2020-2021 evaluation, looking specifically at highlighting activities and progress that we've made towards our system improvement and Sustainability Plan. And then lastly, we spent quite a bit of time with Heather Gonzalez of Racial Justice Advocates, who provided us an overview of their recommendations based on our Ready CR internal survey results. Our next meeting is scheduled for February 18th. And as I said, we've rescheduled those meetings for noon. And that concludes my report.
Thank you, Dr. Fernandez y Garcia. Any questions for Eric by commissioners? Okay, seeing none. Madam Clerk, do we have any members of the public signed up to address the SOS committee?
No, we do not have anybody signed up.
All right, very good. Then, as was alluded to just a moment ago, we will move on to item 8, which is consideration of First 5 Sacramento 2022 policy priorities. Aaron, good to see you.
Aaron, you're on mute.
You're on mute, Aaron. Be good to hear you too.
I just never get to present. Well, good afternoon, Chair Cerna and Commissioners. We are here today to seek your approval of the 2022 First 5 Sacramento policy priorities. And we update these priorities annually through the guidance and recommendation of the Systems Optimization and Sustainability, otherwise known as the SOS Committee. And we use this as a guidance to help support our legislation and advance our policy change. We continue to focus on the 4 areas for policy and advocacy that are health, early care and development, empowered families, and systems improvement and sustainability. So in your packet, there is an attachment where you can see the updates that we have made. They are highlighted in red. And for this year, we added language to support our racial equity, social justice, and capacity building goals into each one of those 4 core areas listed above. So as you review that, those are the recommendations that were approved by the SOS committee. And our policy priorities also align with our continued partnership with the First 5 Association and First 5 California's policy efforts. And that concludes my report. Please let me know if you have any questions.
All right, thank you, Aaron. I do see that Commissioner Wagstaff has his hand raised, so we'll go to Bruce.
Thank you, Mr. Chair. Aaron, thank you for this. And they all look very strong and good priorities, but I would like some clarification on number 7, empowered families. I have a color deficiency. I can't tell if that's red or not, if that's a new one, to be honest with you. But could you give some background on that one?
Of course, Commissioner Wagstaff. So that is all in red. That is a new
yeah.
Underneath, yeah, it's all red for empowered families. And what this is it's building off part of our Ready plan, where we are using parent voices. We want to bring in the parent to have that voice. We want to build up also any sort of like internship opportunities and just have more of that capacity building voice. And under empowered families was the best area to align with our Ready goals.
Thank you. That's very helpful. Thank you.
I would just note too, Commissioner Wagstaff, that I believe number 9 is an all new addition as well.
You're right. Yes.
Okay. Any other questions for Aaron by commissioners? Seeing none, Madam Clerk, do we have any members of the public signed up to address this item?
No, we do not have anybody signed up.
Okay. Before we take a vote, I just want to express my appreciation for the work of the SOS committee. Aaron, thanks for delivering the staff report. I think this represents great work and helps underscore this commission's commitment to racial equity and diversity. So with that, I will entertain a motion.
I would like to move we adopt the 2022 policy priorities as presented.
Okay, it's been moved by Commissioner Sneeringer. Is there a second?
Second.
It's been seconded by Dr. Kasiri. Madam Clerk, roll call vote, please.
Chair Serna,
Aye.
Commissioner Sneeringer,
Aye.
Commissioner Fernandez y Garcia,
Aye.
Commissioner Gordon,
Aye.
Commissioner Kasiri,
Aye.
Commissioner Wagstaff,
Aye.
Commissioner Works.
Aye.
Thank you. Motion passes.
Thank you. Okay, we will now move on to item 9, which is a presentation and evaluation findings from the fiscal year 2021 efforts to reduce African American child deaths. And I believe Julie and Linda are going to tag team this one.
Indeed, we do have, we're transferring over the speakers right now, making them panelists, so it might just take a couple of seconds here to get everybody up and visual in the Zoom meeting. But we are very excited to share the results, and you'll see that these are not only results of just the last fiscal year, but it's a 3-year culmination report of our last strategic plan period. So as folks come on board, welcome, good to see your faces. As always, Linda Fong-Samara does the lion's share of work on our team with this item, and it's always her pleasure to present this to the commission. So I will introduce her first and let her roll out what the presentation will look like and do the other introductions. You're on, Linda.
Great, thanks, Julie. Hi, everyone. Hope you're all doing well. Again, Linda Fong-Samara, thank you for the opportunity to share highlights and updates with you all on the RAACD work. You know, it's amazing. When we were preparing for this presentation, it dawned on me that we have been involved in this work for a decade now. We started the work in the Blue Ribbon Commission around 2011, 2012. So it's amazing how time flies, and I think it's really humbling and exciting to see how far we've come, and I'm definitely hopeful for the impact that we'll have in all the important work ahead. So again, thank you for allowing us to share this update. As you all are aware, the Commission continues to be a partner in the overall Black Child Legacy Campaign, or BCLC as we call it, effort, and all of the important collective impact work that's happening in Sacramento County. I think a lot of the progress that we've had wouldn't be possible without that really interconnected collaborative work that's happening, and it's made all of the difference. And so, again, I'm hopeful for all of that continued partnership and all that work ahead. As we move forward in the spirit of that collaboration, as a commission, we continue to look for ways to continue to really integrate, expand, or enhance the work that we're doing, both on a program level and a systems level, not just to really increase awareness, but to hopefully increase access and utilization for the important services that families can utilize out in the community. One example I'd really like to share with you actually about how collaboration is really making a difference in action is that last year, the Commission, Department of Child, Family, Adult Services, the Child Abuse Prevention Council, and the Sierra Health Foundation were able to submit a joint application to the State Office of Child Abuse and Prevention. And we were able to secure a 2-year grant for $250,000 a year to really enhance and expand Safe Sleep Baby, or SSB as we call it. And so with SSB 2.0, as we're calling it, we're really able to embed Safe Sleep Baby in CPS. And that's where there are kids at high risk of an infant sleep-related death. And that's just an example of how coming together, we're able to do some systems change, because now moving forward, not only will families be able to access that important safe sleep education, we're able to connect them to our partners at the Family Resource Centers and the Community Incubator Leads to get some additional supports and services. And so we're really shifting the way the systems work in the community, all for the improvement of families. So we're really hopeful that we'll see some good results from SSB 2.0, and that we'll be able to continue to look for opportunities to work across partners and bring those skills and those services together to make a difference for our families. In addition to embedding SSB and CPS, we're going to create a toolkit on SSB so that other counties and other communities or other agencies can really develop their own version of SSB. So we're excited to see that roll out into the community as well. So I think what you'll see in today's presentations, just thinking along the lines of innovation, you're going to see a lot of innovation happening in both our funded contracts and also in our partner programs in the community. All the while, they're really keeping community at the heart and the center of their work. So just to give you an overview of what's going to happen in today's item, we're going to start with the broadest level of the work, again with BCLC, and the Sierra Health Foundation will give you some updates on their activities this past year and give you just a summary of some of the CIL efforts that have been happening last year. And then we'll turn it over to our evaluators at Applied Survey Research to give you an update on fiscal year 20 to 21. We have lots of data from our Persimmon system that has client level data. We have some assessments in there, but also we've been able to get some data from our partners as well. And as Julie mentioned, because it was the last year of our funding cycle, ASR will be able to share some information with you based on some analysis of the 3-year period, share with you some outcomes they've been able to find, and also just give you, again, an update on some of the county-wide trends that we are seeing. We will then wrap up with, I see some comments in the Q&A, so we have some funded partners and some community members that have signed up to speak. So we'll hear from them, some comments and highlights they'd like to share with you. So we have lots of exciting information ahead. It's a lot to cover. I think it would be great if we can hold our questions till at least the end of the presentations so our presenters can get through all the material that they have to share with you. Okay, so with that, I'm talking really fast because I want to turn it over to all the great information we have ahead. I'd like to introduce our partners at Black Child Legacy Campaign. So I'm going to turn it over to Chet Hewitt, Shelley Dyer, and Kim Williams. Welcome to all of you. If you give me just a moment, I am going to share my screen to pull their presentation up. But Kim and Chet and Shelley, if you want to unmute yourselves, that would be great. Okay, can everyone see my screen okay? Okay, I'm going to mute myself, and Shelley and Chet and Kim, take it over. Thank you.
Thank you, Linda, for the warm introduction. We're always so appreciative of your work. And as a member of the commission, we know you do double duty, both as our internal representative, but also contributing to the committee's work as well. And also good morning to each of you here. As you know, this is moving into our 7th year of operation as a committee. And I, Chet Hewitt, who get this privilege of actually serving as the chair of the committee as well. And as you know, the committee has been branded the Black Child Legacy Campaign, although it's officially the Committee for the Reduction of African American Child Death. As you know, we just feel that it's better to come forward with a positive message, and that's about building a campaign about health and well-being for children, rather than focusing on the downside effects of mortality and death for children. But we're very happy to be here today, and we look forward and are thankful for the opportunity to come back and speak with you. We are really proud of this partnership and what it's been able to do. You know, it was originally designated to reduce African American child death by 20% in the 4 areas that we know were preventable areas of mortality for children. And as you've heard in past presentations, particularly in our 2019 presentation, by 2018, we were actually able to meet that benchmark, the reduction of African American child deaths by 25%, infant deaths by 23%, and most powerfully in this work, reducing the disparity between Black children and children of other races by almost 50%. So we're really looking forward to seeing the new data that's coming out today as well. As you also know, Black children and families have been under enormous pressure over the past 2.5 years due to COVID as well. The economic, social, mental health status of all families across this country, but particularly families of color and Black families, given the historic nature of this particular work, continue to be disproportionately impacted by the period that we're going through that was generated and initiated by the global pandemic. Now, as we say in the world of health, the pandemic has exacerbated existing realities because there were challenges before the pandemic. And we've seen upticks in areas that are really concerning and directly related to our work, particularly in domestic violence, youth on youth violence, with emphasis on gun violence, because we know the downstream effects of those occurrences are often described as adverse child experiences. If children are exposed to violence in their home and in the streets, and then we know that is not what we want to see, and it works against the outcomes that we seek in the work of the Black Child Legacy campaign. But despite all this, we've made incredible progress, and we've seen our CILs respond in ways that I think your commission will be very proud of, and you'll hear more about that from my colleagues addressed you as well. Could I have the next slide, please? This is just an overview, introduction, which I am doing now. The impact and approach to our work will be done by Sheila Dyer. I want to introduce Sheila. You are all very familiar with our former fearless leader, Ms. Kendra Block Montgomery, who has moved on to work with a member of the commission in a very different capacity at the Sacramento Kings. We were fortunate enough to have recruited Ms. Dyer from the Tenderloin Neighborhood Development Corporation in San Francisco, and we have every confidence that she is prepared to lead the Black Child Legacy campaign into the future and has been already doing some pretty phenomenal work. And I'll be joined by Ms. Kim Williams, who is a Building Healthy Communities Hub Manager, who's been a long-term member of both the commission, but also providing some direct services in communities as well. So we're here today to share that particular update. Could I have the next slide, please? Here you see, and I believe I'm going to turn this particular slide over to Sheila, who's going to pick up the presentation from here. Sheila, you have the screen.
Thank you, Chad. Thank you for the warm introduction also. It's great to be here with you all today. In Sacramento County, Black children were dying at more than twice the rate of non-Black children. This disparity led to the Reducing African American Child Deaths Steering Committee to create the Black Child Legacy campaign with the initial goal to reduce African American child deaths by 10 to 20% by 2020. But the Black Child Legacy campaign actually surpassed this goal. However, we recognize that there's still a disproportionate number of African American children dying, and there's still work to do. We remain committed to the long-term goal to improve the physical, mental, emotional, economic, and social health and power of Sacramento's Black community. Next slide, please. The work continues. The Black Child Legacy Campaign Network has become the backbone of multiple community-led, city and county-funded projects that keep our communities safer and healthier. I definitely want to highlight that the partnerships that we have are integral to our work, and this includes our working relationships with the Department of Human Assistance, the Department of Child, Family, and Adult Services, Sacramento County Probation Department, as well as our hospital partners at UC Davis Medical Center and Kaiser Permanente South Sacramento. But we work every day to improve the health and lower disproportionate and unacceptable death rates of Black moms and babies, preventing and intervening and interrupting violence in and to our neighborhoods, which we'll hear more about that connection of our violence prevention work and ACEs and just our work with the Black Child Legacy Campaign in general and how that all connects together. The dedication of our partners is key to the success of our work. They've helped to build a real infrastructure, real and lasting change within our communities. To share a bit about the approach to our work, as I just shared earlier, We work across organizational lines, and this includes public-private partnerships, removing roadblocks, and centering the in all that we do. Our work also involves strengthening parents, developing youth, healing families, and saving Black child lives. And I'll pass it now to Kim Williams.
Good afternoon. Thank you for having us today. I just want to talk about the programs and things that we have been working on. If we can go to the next slide, please. Yes. So when Black Child Legacy first started, and in our wraparound and working with our partners with the county and probation and all of our partners, we were really focused on serving our families, and we quickly realized that we saw other trends beginning to happen in our communities, and there was the need for supports around crisis response. Thus was born the Healing the Hood Community Violence Intervention and Prevention Program. That program the Healing the Hood program is bolstered by the trusted relationships and infrastructure that was already created through the Black Child Legacy campaign. We already had the 7 sites in place. And so what we're able to do is build up those infrastructures to put what we call community intervention workers at each site, which were designed to really help to start responding to the crises that we were seeing happening in our communities and being able to provide the kind of support that those communities actually really needed. And so when we did that, it allowed us to be able to have folks who can respond to a crisis. If it's a shooting, if it's a domestic violence, they are able to go out to the crime scenes. They work with law enforcement. They're able to support at the crime scene. They're also able to support at the hospital. And that's where you see a lot of their support coming from, and where you see a lot of the impact that they have taking place. So in total, in just the last year, we know the pandemic we are not immune here in Sacramento County to the increase of violence that we've seen across the country due to the pandemic. And this past year alone, we were responded to immediately in follow-up responses to 131 crisis response incidences that took place. And of those responses, 80% of those responses were directly related to gun violence, gun shootings. And that meant showing up at a crime scene, showing up at the hospital, supporting families all the way through. At the hospitals, they're working with the families to be able to garner information. They're working with families to find out what resources that they need. And then, there's the follow-up that happens after the crisis, because once we've done that, we find that the families are really in need. And so, we were able to support another 122 young people with one-on-one wraparound services and case management. And because of the structure that's already put in place with Black Child Legacy, we're able to just move those families on to additional supports and that wraparound to really take those families and help them and hold them through their very emotional times that they're going through, but also then to help build them up so that they can continue on as successful families. What we also find is the majority of the cases that we're working with, there's young families, there's young siblings in the household. More often than not, there's, elementary school and kindergartners and younger in the family. And so what we're finding is that we also are having to work with the schools and work with families even more in depth and looking at how we're getting counseling for those families. We had one incident recently where unfortunately, a 17-year-old young lady lost her life to gun violence. And, immediately our CIWs were sent to the hospital to support the families. And walking into that situation, you've got young children who are seeing this and who are in this emotional scene, and our CIWs knowing what to do to immediately remove them from the situation, but provide them care and get them into a safe environment for themselves. But then what happens after that is really impactful. And then how we're able to walk those children children through to the next step, I think becomes really important in providing that support to the families, getting through the funeral services, going through victims assistance, getting grief counseling, getting mentorship programs for the young people, food, diapers. I mean, you name it. That's what the Healing Hood program is providing for those families. So we're out there with the crisis, and we're out there to support what's happening with law enforcement. Like, how do we prevent another shooting from taking place so that we don't have retaliations happening? And our community folks who are involved in Healing the Hood, they work in these communities, they're committed to these communities and doing the work. Next slide, please. And the work is really and being tied to that. And so it's important to mention that, adverse childhood experiences, have a lasting effect on the lives of the children. And when, an older sister or an older brother is lost to violence, or those children have witnessed a domestic violence situation, and that's happened in their home, it impacts their lives. And it leaves a lasting effect on their life, and it impacts their future and their potential to be able to thrive. And with programs like violence prevention programs like Healing the Hood, we're able to come and try to provide a safer environment, a safer community for those children by doing intervention work as well as the prevention work, which is so important. It begins to create safer communities for our children. And that's the key to all of this, is we want our children to be able to live in communities that are safe, happy, and healthy. No child should have to live with violence as a norm on a daily basis in their neighborhood. And that's really what Healing the Hood is striving to work for. And it's been successful. And we just want to continue to see it to grow so that we can have more impact on more communities and begin to protect more children. Next slide. What makes our program so unique is the fact that we have our community intervention workers who are extremely tied to their communities. They have what we often call a license to operate. They can move in communities in ways that you and I may not be able to. We just have a few quotes from some of them that work in, one CIW lead said, "I can go into any neighborhood throughout Sacramento and it's okay. The way we disseminate and knowing people in the community, knowing Grandpa Johnson that lives over there, knowing who his grandkids are, knowing who his dad is, knowing who people are in the community." And that's what makes this program successful, is they know those communities and they work in those communities. Another said, "I think one of the most important things is that the CIWs are knowledgeable about the community in which they're serving in. They understand what's important and they understand the dynamics of the community. They understand community politics. They have what we often refer to as a license to operate in those communities." I think that it's a big piece of why they're able to connect with the young people in the way that is unique to community. They can reach out to families. If we have an issue with the family, that CIW can reach that mom or that dad in a way that, sometimes, our other resource folks can't, and help to get them the services, because there's often fear and mistrust in communities. So with Healing the Hood, we've been able to really break down a lot of those barriers, but we've also been able to make a difference in so many lives of so many children and so many families. And we just want to continue to build this program to make it stronger so that we can have a stronger impact, so that we can really change these communities, so that children are living in communities where they're safe and they can sleep at night. And that's the most important thing. Thank you. And I'll turn it back over to Chet.
Next slide, please. And I think this is our closing slide. We all want to say thank you to this particular commission and its foresight over a decade ago to begin to put this program in place. You've heard a lot about Healing the Hood today, but I want to assure you that we remain committed to ensuring that the perinatal conditions and access to healthcare is a key part of our work. We want to assure you that addressing sleep-related infant deaths remains a core part of our work, as does our response to child abuse and neglect death rates as well. I think our focus of this particular presentation around the Healing the Hood component of the Black Child Legacy campaign under the auspices of the Reducing African American Child Death Committee is representative of the times in which we are living, the stress that communities are under, and the impact that exposure to violence is having on very young children. We know that over 250,000 children in this country have lost their primary caregiver, and I'm speaking about very young children. We know we've also had some recent high-profile shootings of children 5 and under. We know that classrooms with missing seats of children who have done by gun violence not only impact the teacher and the family of that child, but also impact all of the students in that particular classroom who have to come to grips with why that particular child will no longer be a classmate. So when we think about the Black Child Legacy Campaign, the impact that it's actually having, its ability to respond to the current circumstances in which we're living, even as we begin to drive towards our ultimate goals of reducing preventable Black child deaths in the 7 communities in which we are currently doing our work. We do know that if we put communities at the center, we have to always remain responsive to the challenges they deem top of mind in this particular work. So let me end there, and we'll take any questions if we have time, or perhaps they'll be at the end of the presentations, as Julia said. But we just want to end with a big thank you to this commission for your willingness to sustain this work over the past 7 years.
Thank you, BCLC team. Any questions for BCLC?
Okay. Hey, this is Scott. Can I make a quick, I don't necessarily have a question, but just a comment?
Yeah, please.
I just, two things really. I want to, and I'm driving extremely safely, and I'm an Uber driver anyway, so we're all aware that I do this for a living. I just want to say thanks again to voices like Kim and Chet, who, when something good comes about and those kinds of people join it and lead it with their vision and values, what they stand for and their credibility, I mean, it just gets better. So I'm so thankful that it's the two of them and many others with the Black Child Legacy Campaign family that have just done incredible work. And obviously there's still more to do. So I just want to say thanks to them. But I need to, this is my annual, I just feel like I do this every year and he gets pissed because he's, but to Phil Cerna, I was on this committee. I'm now one of the longest tenured commissioners. And I remember talking about this issue for a long time, too long, talking. And it wasn't until he was there, and bless, I adore some of his predecessors and people who were involved before, but he put the money in and made the investment and took a chance. And it wasn't popular at the time. I'm sure many of you remember that. And it was a risk on multiple dimensions, and he did it. And I'm just so happy that I know there's still more to do, but I'm so thankful that we have leaders like him who are willing to put themselves out there and take a giant leap and move us from just talking and town hall meetings and all these things that certainly are also important, but action and resources are critical. And he did it. And so I just want to use this moment again. I know I do that every year, but I just want to say thank you to Phil.
Thank you, Scott. I don't see any other, I do see some hands raised. Okay, very good. I apologize. I wasn't paying close enough attention to see whose hand went up first. I think Dr. Kasseri and then Commissioner Turner Johnson.
I have to get off mute. Thank you. I actually wanted to add to what Scott has talked about, because I'm very familiar with a number of the efforts that we tried to initiate in Sacramento County to work on these issues of disparities in child death. And however good our plans were, when it came down to the action part, because we didn't have the money or the backing, the political backing, somehow those efforts fizzled out. And so also want to add to what Scott has said that I do appreciate that this time around, with the addition of the support from Supervisor Cerna, that we were able to go beyond just coming up with good plans or talking about the problem and actually doing something. I think I've said this before, but I'll say it again, that I think the way that this was approached was different from the way that we usually start our initiatives, especially because most of the time is federal state funding, where we are given a scope of work or told what activities we're able to implement. But this time around, it was really grassroots, where we went to the communities and said, okay, these are the issues. How do you think we can approach the solutions? And I really appreciate the involvement of the community members in addressing the issues that they're seeing within their communities. So appreciate all the work that has gone into this, and all of the leadership, and also the individuals of the steering committee that have continued to meet and provide guidance for this. So thank you.
Thank you, Dr. Kasiri. Commissioner Turner Johnson.
You know, in thinking back to when this was really non-existent in the way that we see the service report today, which is, in reading it, I have to say that looking at some of the numbers that have decreased has been so heartening, and yet knowing that even at the better times before the pandemic, that there was so much more to do. And realizing I live in a neighborhood where I listen to the ambulances go by. I live more towards the Oak Park side of town, but I know you all share this feeling that hearing that in our community, knowing that it may be anything from the pandemic to the after effects, the intersectionality of the results, particularly in the most vulnerable populations, my heart has just never stopped hurting. And I don't know that it will, even when the pandemic hopefully clears. We, with the kind of work we all do, carry this in our souls. And I remember when I first started driving around long before I was commissioner and listening to the vision of what needed to be done. And when I look at the intricate infrastructure now that I see on the screen of the titles and the service types of interventions that have evolved through all the hard work of all of you on the team that have done this, it helps to alleviate that hurt and makes you feel a little bit of singing in your soul that, you know, what if we had done none of this? How much worse would it be than it is, even though we know that the task is enormous and ongoing, and we don't know that we will ever completely turn this around, but at least there are tremendous positive impacts. So I just want to say that we miss Kendra. I'm sorry to see that Kendra's gone. I really loved her. But at the same time, we thank Shelley. I already can see the professionalism that she projects along with all the rest of you. And so we can only say thank you. And we're so glad we're part of this collaboration. And we hope that we can just continue at deeper and deeper levels. And Phil, there is no doubt that what you did with Chet, and of course, I just want to close saying that, Phil, you took this and ran with it and made it a very deep mission of yours. And without that and the collaboration with Chet and all the team, it just wouldn't exist today, period. That's all there is to it. There's nothing more to say about that except thank you, a deep, deep thank you. And I'll close by saying that Grantland would be so proud. He would be so proud. I feel him. I'm in his chair in his office, and I'm telling you that, you know, he has a very light heart where he's out there working on himself, he says. And I know he's dancing and singing and going, thank you, you guys. Keep it up.
Thank you, Lee. Those are very precious words. I appreciate that. I don't see any other hands up at the moment. I assume, Madam Clerk, we have folks waiting to address the commission, but I do want to add some words before we take any public comment. I can't begin to express enough how grateful I am to Chet, to Shelley, Kendra, and Abstentia, to Kim, Dr. Kasiri, Scott, Donna, Beth, Sheila, Michelle, Linda, all of you. It is an initiative that I am extremely proud of. There's hardly a conversation that I have about being a county supervisor that goes by that I don't lead with the work that this team and others have accomplished. And Scott says what he says, I guess, annually. I say this annually, that the design on this from day one was, this eventually has to be owned by the community. And I think we can say, in all honesty, that it is owned by the community, the good and the challenging. And as far as the future of the program and the BCLC and RAACD effort, great work of the steering committee. We should all take some personal responsibility, and I'm sure we do. But when people are running for office, especially at the county level, but regardless if it's school board or city councils or what have you, this should be part of the questionnaire, so to speak. It should be part of the conversation about how they see themselves fitting in to help support and enhance the work of the BCLC. And because we are in election cycle right now, pretty active one, and we can expect a new member of the Board of Supervisors, at least one new member, maybe more, I don't know. That should be front and center in terms of making sure that future generations of the board continue to flank the effort and not just give it lip service, but make sure that it has all the resources necessary to continue this great work and save lives and reduce the disparity. That's what it's all about. So with that, if we don't have any more commissioner comments or questions, I'm going to ask the clerk to bring in our first public commenter.
Actually, oh, sorry.
Oh, I'm sorry, Linda, go ahead.
Chair Stern, if I could actually go ahead before we take public comment, I'd like to turn it over to Alyssa at ASR.
Oh, I'm sorry.
To provide a presentation, and I think they'll have a lot of great additions to really show how the First 5 Sacramento funded work from a numbers perspective is contributing to the overall countywide effort. So I'm going to turn it over to Alyssa, and she's going to share screen. Thank you.
Okay, I'm just going to go ahead and get my screen sharing, and just give me a second to shift all of our windows around so I can see. Okay, so my name is Alyssa Mullins. I am a senior research analyst with Applied Survey Research, and I'll be presenting a brief highlight overview of the full report of the reduction of African American child deaths for fiscal year 2020-2021, which also includes the 3-year trends. First 5 Sacramento leads the Reduction of African American Child Deaths Initiative, or RAACD, in support of countywide efforts to reduce the disparities of African American children dying at twice the rate of any other ethnic group in the county. As our previous presenters mentioned, in 2013, the Blue Ribbon Commission on Disproportionate African American Child Deaths established an overall goal to reduce the African American child death rate by 10 to 20%. The Blue Ribbon Commission goals also included specific targets for each of the 4 leading causes of deaths among African American children: perinatal conditions, infant sleep-related, child abuse and neglect, and third-party homicides. The RAACD initiative targets the first 3. with First Five funding a perinatal education campaign, raising public awareness of racism as the root cause of disparities in safe births, a safe sleep education campaign, direct services and support from family resource centers, and a pregnancy peer support program. These efforts also include a particular emphasis on the neighborhoods identified as having the highest rates of African American child deaths within the county. Today, we'll be providing an overview of these four First Five funded programs during the 2020-21 fiscal year and review countywide trends in child deaths by the three causes addressed by this initiative. So as mentioned on the last slide, the Public Perinatal Education Campaign focuses on increasing public awareness of racism as the root cause for racial disparities in safe birth outcomes for both mothers and babies, and provides ways for community members to take action. The Commission continued its partnership with Sacramento County Public Health on the Joint Unequal Birth Campaign. Runyon Saltzman Inc., the media contractor, created new social media ads and revised website content implemented to encourage engagement. Social media ads received over 1.6 million views and over 24,000 clicks, with the click-through rate exceeding industry benchmarks. Nearly 15,000 unique users visited the website over 19,000 times, and there were about 200 clicks on the Take Action webpage. The Safe Sleep Baby Education Campaign targets knowledge and behavioral change about infant safe sleeping practices to decrease infant sleep-related deaths. 691 parents and caregivers received the 1-hour direct education training. Among them, about 1/3 were African Americans, and more than half lived in the high-risk target neighborhoods. After the training, we saw improvements among African American participants, with a larger proportion of reporting that they never slept their baby with blankets or with an adult, and fewer slept their baby in an infant bed. In an adult bed. Definitely infant bed is preferred. Unfortunately, there was a decrease in the number of parents always sleeping their babies in their crib or pack and play compared to those intending to use the safe sleep practice at intake, although a small sample size can impact how steep this decrease appears. Cribs for Kids partners distributed 331 cribs to caregivers in need, 35% of which went to African American families. And in addition to direct support for parents, 280 community-based service providers and 3 medical providers received safe sleep workshop trainings, and safe sleep baby education continued to be implemented in all of the main birthing hospital systems in Sacramento. Next, the Family Resource Centers provided a number of services to support families with acute crises or overall education and support, with a specific target of reducing child abuse and neglect homicides among children from birth to age 5. These services build the protective factors that give parents skills to deal with stressful parenting situations. In looking at the home visiting and parenting education workshop series, we saw overall improvements among African American participants on their average adult adolescent parenting inventory, or AAPI, scores at follow-up. The AAPI domains intend to measure risk of child abuse and maltreatment, with higher scores indicating lower risk. In particular, there were significant improvements in measures of family roles for both groups, and significant improvements in empathy scores among home visiting participants. And as an added note, these data are from all 9 FRCs, although a majority of African American clients discussed here were likely served by the Valley High, Meadowview, and Arden Arcade FRCs, with Valley High and Meadowview expanded and Arden Arcade reestablished to meet the needs of African American families. The last First Five funded initiative that we'll be talking about today is the Black Mothers United Pregnancy Peer Support Program. BMU uses pregnancy coaches to meet one-on-one with women to provide education, coaching, and support to address risks to healthy births and to promote healthy infant and maternal outcomes. BMU served 159 African American pregnant women. More than half joined during their second trimester, but the program has increased the proportion of mothers joining earlier during their first trimester from 15% in the 2019-2020 fiscal year to now 21% joining in their first trimester in the 2020-21 fiscal year. At intake, BMU collects information on clients' health and socioeconomic risk and protective factors. 94% of the clients served in fiscal year 2020-21 had at least one risk factor. After participating in the pregnancy peer support program, more mothers were using protective factors, with nearly all engaged in WIC services and more than half enrolled in CalWORKs. And the participants also had significantly fewer risk factors by the end of the program. For instance, the proportion experiencing unstable housing reduced by half. Only 3% were reporting moderate to severe depression at follow-up compared to nearly 1 in 5 mothers at intake. And none of the participants reached at follow-up reported that they were unable to fulfill their food needs compared to 13% at intake. There were 85 live births by mothers engaged in the BMU program, and there were 0 stillbirths or infant deaths prior to the mother exiting the program for the 2nd consecutive year. Among the 85 births, about 3/4 were considered a fully healthy birth, meaning that they had a healthy birth weight and were full term. 84% of the births were at least full term or healthy birth weight. And only 9%, which equals 8 babies, were born low birth weight and preterm. So in addition to the program-specific data, the report that we have looks more broadly at countywide trends over time as well. Looking at the countywide trend data, we can see an overall reduction in African-American infant deaths since the 2012 to 2014 rolling average baseline, which exceeds the Blue Ribbon Commission goal to reduce African-American child deaths by 10 to 20%. There has been a slight increase in African-American infant deaths in the past 2 averages, which was impacted by an increase during 2018. But as we can see on the next slide, the total number of African-American infant deaths in 2019 specifically, just 13 here, is actually lower than 2018 and 2017 values, despite the increase in the 3-year rolling average rates caused by this 2018 spike. So even though the number has gone up from 8.8 to 9.0, we actually have a bigger drop for the most recent available data. So next we'll look at infant deaths by cause. First, African-American infant deaths by perinatal causes continued to decrease, with the most current rolling averages estimates are lower than any previous measure and 10% lower than the baseline. Infant sleep-related deaths have also declined, with a 56% reduction since the 2012-2014 baseline, and a significant reduction in the disparity gap between African-American infants and infants of all other ethnicities. And among all children ages 0 to 5, the countywide rate of deaths due to child abuse and neglect homicides declined significantly, with an 85% reduction overall since the 2012-2014 baseline. There has been a slight increase since the last value reported, but this 2.7 value here represents 1 individual death during this 3-year period. So for our last section, we partnered with the Department of Public Health to identify 12-month outcomes of births to mothers that were directly served by the RAACD pregnancy peer support programs available during the 2016 to 2018 timeframe, specifically looking at BMU and the previously funded WellSpace Health Cultural Broker Program. The cutoff stops at the end of 2018 because child death data were reconciled through 2019, which allows us to view 12-month outcomes. During this 3-year period, there were 570 births to mothers directly served. Unfortunately, 2 of these infants did die within the first year of birth. One was born at 32 weeks and died shortly after due to perinatal causes, and one had an undetermined cause of death at about 5 months of age. These 2 deaths reflect an overall infant mortality rate of 3.5 per 1,000 births, lower than the current countywide rates overall, as well as for African Americans countywide. The 1 death due to perinatal causes reflects a rate of 1.75 per 1,000 births, compared to 3.8 among African Americans countywide, and approaching the overall countywide rate of 1.6. So our key takeaway here is that despite the unfortunate passing of 2 babies born to mothers served by the RAACD Pregnancy Peer Support Initiative, the participants' infant mortality rates were lower than countywide rates. And I'll go ahead and close our presentation from here and stop sharing my screen so we can open it up to the next step.
Great, thank you so much, Alyssa. So those are our 2 formal presentations, and I hope that between the 2 presentations, you're all able to see the impact that all of these efforts combined are having in the community. You can see from Alyssa's presentation of the data, our first 5 funded programs are having a significant impact, but also overall on a countywide level, through all of those collective impact efforts, we're not only seeing a decrease in the rates of deaths, but we're seeing a decrease in the disparities as well. So we're happy to report that data to you all. And so at this point, I'd like to open it up again for any questions for Alyssa and Lisa at ASR or for our partners at BCLC.
Okay, thank you. Commissioner Wirtz.
Yes, just a very brief comment about the data that goes into this. I just want to say that that data depends on all the partners that are doing the hard work on the ground to address our families and provide supports. But it also involves a lot of partnerships and collaboration within the county systems with CPS and our partners in our county government, as well then as our first 5 staff, and then of course our Alyssa and ASR work. A lot goes into getting the partnerships to get this data, to refine it, and to get it into a point that can make a story here, and that allows us to see not only the qualitative side of things, but also look at this quantitative reality that we are seeing some powerful impacts of the work that everyone is doing here. So, you know, we've talked about the people involved in doing the work, but I just also want to give credit to those who then have to go to the trouble and difficulties of trying to track and justify and demonstrate the value of the work that's being done by all the great partners. So just a comment on that side of things.
Thank you, Commissioner Wirtz. Any other questions or comments from commission members? Okay, Linda, is now the time for public comment?
Yes, thank you.
Very good, thank you. And thank you to ASR for the presentation. All right, Madam Clerk, first call in.
Thank you. We have 7 speakers signed up, and if anybody else from the public would like to address the commission on this item, please enter your name in the question and answer, and I will add you. The first speaker we have is Kenya.
Hi, good afternoon, everyone. Chair Cerna and all the commissioners, and of course, First 5 and everyone involved. I am here speaking on behalf of Her Health First and our Black Mothers United program. And Shannon, our fearless leader, sends her best regards. She had her husband's father passed away, so she's up in Oregon right now and traveling back from Oregon. So she sends her best to all of you. And just wanted to, Commissioner Wirtz mentioned about that kind of qualitative reality of what it takes, and particularly in this time of COVID. So I wanted to share a little bit about what that's been like for us. And I think we were probably one of the first organizations that shifted to working to a more virtual platform. And in all of that, figuring out what it would take and what we needed in order to keep our staff safe and the families that we serve safe. And so that was a really important step for us. And it took a lot of planning, and can't thank First 5 enough, Linda, Julie, and Carmen, because they were very intricate parts that helped us to shift into and keeping us informed about the ways in which we needed to do that and how we could do that. And so we first invested in a platform called Mommy that allowed us to go from paper to virtual. And so we continued to do our weekly check-ins with our mothers and make sure that we were able to care for our families and wrap around services, but we needed a tool to be able to do that. And Mommy has fit the need for us. It's more of a telehealth type of platform, and it allows us, it was already built up for prenatal care and postpartum care. So it has a lot of material and information that's easy to share with our families. And it allows us to schedule appointments, do charting, do virtual appointments there and email and messaging of that sort, as well as our assessments all loaded onto that platform. So it's been a very useful tool to us. And one of the other things is we had to immediately figure out how everyone else was operating, who our partners were, and how to connect with them now in this new virtual, way of living. And so that was going to be critical for us to link back up with our BCLC, CIL sites and make sure that whatever meetings that they were having, that our staff were able to participate and stay connected, stay a part of those MDG teams, and continue to provide the services and cross-refer was very critical. And we also had to beef up our social media platforms as well. That was how we were able to outreach to our community. We weren't able to go to those tabling events like we have in the past. So it was so important for us to have some messaging go out to our community so that they knew we were operating still and how we were operating, how they can get in touch with us. And how do we then make sure that we are getting materials to moms and providing transportation and all those things that we have done in the past, where before we were able to use our personal vehicles to transport moms to medical appointments. And so it was, again, making these connections, making sure that there was a lot of fear, especially when COVID first kind of came out, is like a lot of moms didn't want to go to appointments, or they were having challenges getting to appointments or making appointments. And so we were really working with them and the medical providers to make sure that moms either knew how to go on and get a telehealth appointment, or make sure that they had the resources to get to an appointment. So a lot of Uber cards, gas cards for families, things of that sort, to help families be able to make it to these appointments, the critical appointments. And then we had an opportunity to get some dollars as well to start a CARES program, and that was connecting families to much needed resources for bill assistance, food assistance, you name it. There was a lot of, and PPE to make sure families had masks and knew where all the testing centers were, and any type of messaging that was coming out, that our families also had access to that. Her Health First Black Mothers United program has developed this 5-stage approach where we are now expanding, been able to expand through some dollars, not only from First Five, but also the Cal Mesa's maternal mental health funds. And that allowed us to build up our Black Mothers United program by adding a campaign that focused more on anxiety, pregnancy and anxiety and depression messaging, and making sure that families understood what PMAD is and where resources are in the community and how to get them connected to services in a timely manner, and deal with some of the stigma around mental health and access to care. And lastly, we added a doula service to it. We added lactation. We just kept our Mommy Mingo program going and our baby showers. And we were all able to do that through these virtual platforms, and it's been successful, challenging, but still successful. So with that, I won't hold up any more time. I just wanted to give a little bit of shed light on what we're been able to accomplish and some of the challenges that it took to get there, but very happy to be able to do this work and so happy about the success that we're seeing in these trends. Thank you.
Thank you, Kenya.
Thank you. Our next speaker, please, I apologize if I mispronounce your name. Karis Chiagi.
That's closer than our former chief of police. My name is Kairis Chiagi. I have the blessing of being a staff doula at Her Health First to roll out this program to provide support, not just at a basic needs level, but the next level of addressing trauma and anxiety. Because unfortunately, we live in a world where actually your birth can be your first adverse childhood experience. And so we want to stop that right there. And so in this few moments, I've been doing this work for 23 years next month, and as a community and professional doula, so I have a little experience out there. But I wanted to share with you a quick story because numbers are wonderful. God bless the data keepers and translators, because that is not my wheelhouse. But numbers don't always tell you the full story. So I just wanted to share a quick experience with you. Lashanya, who is actually on this call and out there in the chat, referred a young woman to me who was 16 years old, pregnant with her first baby during COVID, because there's not a whole lot to do when you're on lockdown, but there are babies that happen, lots of babies. And this young woman's baby decided to be dramatic. And so he could not be born vaginally. He had to be delivered by C-section during COVID, which limits how many supporters you can have. And on top of that, her mother had recently had hip replacement surgery that went wrong. And so a second surgery emergently had to remove that new hip. So she didn't have one, she only had one hip. So she was confined to a hospital bed in the living room while her teenager was scheduled to have her birth surgically. And I was asked to support them and to be there. And of course, like any 16-year-old facing the biggest moment of their lives, she wanted her mom with her. And so God bless the doctors who scheduled her for a 5 a.m. appointment. I left my house at 4 a.m. to go pick up her, and surprise, mom was coming to her in her wheelchair. And so we did the thing. We got her in the car, drove to the hospital at dark 30, convinced a hesitant security guard that yes, you're only supposed to allow one person up with the pregnant teen. However, the disabled mom could not manage this on her own, and she was also not going to miss the birth of her very first grandchild. So the three of us went up for this surgery, and mom really wanted to be there. And so the hospital was able to figure out, we brainstormed, and it's like, you know, you guys have those little skinny wheelchairs in here. She can transfer herself to that one. Y'all can roll her in right in between the oxygen tank and the anesthesiologist, and she can be there when her grandson is born. And so she was able to do that. And when baby was born, they brought him out to me so that mom could stay with her while they finished the surgery. And I brought the little guy out in the room to wait. And grandma was able to be a part of his first feeding and all of those things, but also just mother to mother, we were able to address her anxiety and maybe even trauma over her teenager now becoming a mom when she had so many dreams for her baby, and, you know, her own hurt in addition to needing to be there for her daughter, and still in the midst of her own very significant health challenges. So I am happy to report young mama sends me pictures of this cute little guy every single week. He's adorable. He has more shoes than I do. She is back on the path of her education. Grandma is adjusting and in love. And thanks to the team at Black Mothers United, they had all of their needs met in terms of bedding, safe sleeping, and all of those other supports. So if you want to look at the whole picture, this was it from birth to third generation in a family, the grandmother, the mother, the baby. You guys are firing on all cylinders. So thank you.
Great, thank you.
Great. The next person to signed up is Stephanie Biegler.
Good afternoon, Chair Cerna and commissioners. I'm Stephanie Biegler, the Chief Program Officer at the Child Abuse Prevention Center. And I have the honor of making a few comments on behalf of the CAPC Safe Sleep Baby team of Renee, Diane, Maya, and Jasmine, who are to be thanked beyond measure because they really are the folks that have been dedicated to and committed to the results that Alyssa and ASR just presented to you earlier. When we started to plan and develop our Safe Sleep Baby message and program, we really designed it in such a way so that the power of the program could be a program created for parents by parents. And when we spoke to 160 African-American parents and who shared with us the message that would resonate with them, it is really gratifying to see the results today from what they clearly directed this program to do. We certainly share with you the pride that there has been a 56% decrease in the rate of African-American infant deaths exceeding the target of 33%, and that there has been a 65% decrease in disparities between African-American infant deaths and those of other ethnic groups. We also want to thank the commissioners, Julie, and the first 5 staff for your support of this program that really is a way for us as a community to leverage the partnerships that Linda spoke about and also become a model for the state. I had in my notes to share with you about the funding from the State Office of Child Abuse Prevention that Linda so graciously shared earlier. The challenges of COVID also intersected with Safe Sleep Baby. And new moms really didn't want anyone other than their family to be around their babies. So what did the SSB team do? They took a very innovative approach, kind of like DoorDash, and we called it Crib Dash, only it kind of was like without the dashing. So the team would schedule an appointment with a mom for our 1-hour Safe Sleep Baby workshop. They would drive to the residence. They would put the crib and a hold harmless agreement on the front porch, return to their automobile that was sitting in the driveway, watch the mom get the pack and play, sign the hold harmless agreement, and on Zoom from the cell phone, go ahead and conduct the 1-hour workshop. At the end of the workshop, the hold harmless agreement and any other paperwork was left on the door front, and our Safe Sleep Baby health educators went on their way to go ahead and to educate the next mom. I wanted to share with you some comments about a mom that was co-served from the Black Infant Health Program and Safe Sleep Baby. We are very grateful for the $200,000 or so that we receive every year from the First 5 Commission to implement Safe Sleep Baby. However, as I just mentioned, this is a program that needs to be co-served and needs to be integrated in other programs throughout the county. And because CAPC is fortunate enough to be a BIH provider from Sacramento County, we have the internal capacity to co-serve. And one of our moms shared that when my little one was born, I did the Safe Sleep Baby workshop with Maya. And the information I learned was amazing. I didn't know what crib safety, easy for me to say, safely sleeping your baby was all about. I didn't know about SIDS in detail, but after that course, I started implementing safe sleep practices immediately. I'm super glad I'm part of this program. As Safe Sleep Baby looks ahead to our next 3-year funding cycle, one of the things that we are in the process of doing is auditing our Safe Sleep Baby message and materials to ensure that they still remain relevant, and when they do not, how they can go ahead and be updated to better meet the needs of moms in the 2021 era. We've done some preliminary focus groups, and we're pleased to say that the message, the colors, the materials remain valid. Moms are verifying and validating that they're learning from those messages. However, the preliminary feedback that we are receiving is that we need to empower moms more through the video and verify that they have the ability and they have the once they have the education, that they then have the power to go ahead and to be great moms and ensure not just infants sleeping their infant safely, but also be great moms about other aspects of their infant's life. So once again, thank you so much to your support, and we look forward to presenting to you similar outcomes in the next 3-year funding cycle.
Great. Thank you, Stephanie.
Thank you. The next person we have signed up to speak is Sheila Boxley.
I'm so very proud of myself that I unmuted. This is unusual for me. So, but I want to tell you that I am truly filled with gratitude based upon what I've been hearing today and obviously knowing about for some time. I am certainly grateful to the 20-something agencies who participate in the Child Death Review team, because their work was really an impetus for this. And I am so grateful to you, Supervisor Cerna, because I had to tell those same data points year after year in front of the Board of Supervisors. And finally, there was a moment when you looked at me and said, "What did you say?" And it was an epic moment for me in terms of change. I'm certainly grateful to Chet and Kendra and Kim and pretty much everybody else on the screen today, and all the other partners who have been engaged. I jokingly say to people that my middle name is Prevention. It's really the middle name of my organization, but in our reality and in all of the work that I do statewide and otherwise, there are 3 issues that are the most pressing ones that people care about and are talking about. And it's equity, it's primary prevention, and it's community and lived experience. And this program and what has happened is absolutely the model of all 3 of those very important issues. And I think there's much for everybody engaged in this to be proud and to know that this is a model and a collaboration that is unique in our state, and I dare say our country. So very proud to be a part of this. I am here to talk now a little bit about the reduction of child abuse and neglect fatalities. And in particular, the role that the Family Resource Centers have played in that. Most of you know that for over 20 years, the Birth and Beyond Family Resource Program has been active in 9 communities. And those 9 communities, for the most part, coincide with RAACD communities and areas. The composition, the primary composition is 7 of the community-based organizations here in our community, but there is a plethora of partners and others who are also engaged in that work. Just to give you a little bit of scope, in 2021, the Birth and Beyond Family Resource Centers served about 5,000 adults and children. And of those, 23% identified as African Americans. And I'm happy to tell you that with the data for this year, the trend is in fact increasing in terms of that percentage. All along, Birth and Beyond has had some special programs and services that continue to exist: community outreach, home visitation, parenting education, crisis intervention, and what we call enhanced core services, which means anything else that anybody needs. And I was really reflecting on what Kenya was talking about in terms of COVID and what that's really meant in terms of the work for Birth and Beyond. Whereas the biggest focus has often been on home visitation, with the onset of COVID and even into now, crisis intervention has become a huge part of the work. I don't think that's a surprise to anyone. Everything from mental health crises to economic crises to deaths in the family, really very compelling kinds of changes. And appropriately, the program pivoted to do the services and meet the needs of the families that they were serving. And also in that little category that we call enhanced core services, that's everything from helping children with distance learning to delivering food and diapers and formula, to getting people access to vaccinations as well as to testing, and also doing some incredible pivoting around home visitations being done virtually, training for new staff being done virtually, really using technology and being very creative in order to continue to do the services, not in the way maybe they had always been before, but nonetheless still providing those supports for families. I believe that it's really important for me to also share with you on behalf of my colleague agencies, and those are La Familia Counseling Center, WellSpace, Mutual Assistance Network, Sacramento Children's Home, and River Oak, as well as my organization, the Child Abuse Prevention Council. And collectively, we have been engaged for some years now and very committed to a process of cultural responsiveness. And everyone at every level, including the EDs who participate at least monthly in working on this, are very committed to an action plan and a future. And it doesn't have any end to it, but it is an ongoing commitment. I really appreciate what ASR spoke about, but I want to go back a little bit to some of those numbers because I think they're quite incredible. When you look at that graph and you look at the reduction in child abuse and neglect fatalities, it is astounding. Even if you don't have the numbers, you look at that picture and you see that change. But what we also saw that I think is absolutely critical and important for us all to celebrate is that in terms of the families being served in this arena, there's been a 95% decrease in the diversity gap between African-American families and other ethnicities, 95%. That is wonderful work. That is something clearly to celebrate. And as others have talked about in terms of the work on the ground, I am not privy to be one of those people, but I can speak for those people today who do that work, whether it's home visitation or parenting education or delivering formula. We have certainly seen important stories that very much reflect the ones you've already heard. But I can think about both one mother who was living with 2 children and was pregnant, who lived in a car. I can think about the mom fleeing from domestic violence, who now has been accessing education, has a safe place to live, and also has now seeing in her son through the work in parenting education, a transformation in him to being more empathetic. So we see that there are real changes, meaningful changes. And then I will just close with, I guess, maybe a spoiler alert that in a couple of months, your commission is going to be presented with the latest quasi-experimental design evaluation for for Birth and Beyond. It's funded through our AmeriCorps grant, and the evaluators are ASR, our pals who are here today. But what they're really measuring is, in particular, the decrease of entries and re-entries into child welfare as a result of the services. And while that's not exactly the same thing as reducing fatalities, it is very closely connected to that. So again, I think we're going to have some more positive news. And also, again, thank you to everybody involved in this, everybody here, and very, very importantly, the people who aren't here on the screen, but who are every day really making a difference. So thank you all.
Thank you, Sheila.
Thank you. Our next speaker is Michelle Quija.
Good afternoon, Chair Cerna, commissioners. Wow, what a wonderful presentation. I'll start off first with joining the Supervisor Cerna gratitude train. Supervisor, we simply would not be here today without your leadership, hands down. So thank you for that. And then also recognizing Chet Hewitt for his extraordinary leadership, and Ms. Dyer, Ms. Williams. The whole team has been absolutely phenomenal. And I know that there are far more further behind the scenes supporting this effort. I have been asked by the state about Black Child Legacy Campaign, and kind of how I describe it over the last seven years is like an octopus, and they see a need and they grow another arm and it reaches into the community to meet needs. And then there's another need, and then the pandemic hits. And it's simply amazing how many tentacles out into our community have been formed over the years. And I know that for our department, no surprise to anybody here, African-American children and families are disproportionately represented in our Sacramento County child welfare system. And I think that over the last 7 years, we have made some strides in reducing those disparities, but we have a lot further to go. And I think that this whole campaign has created even not just more of a sense of urgency. We've been focused on this. It gave us structure, and it also gave us partnerships, as Ms. Williams said, like the crisis intervention workers, the folks in our community incubator lead sites, the folks at Sierra Health Foundation, they have license to operate. CPS does not, and yet we've been able to partner to make improvements in some of our practices and systems. Again, we have far more to go, and I look forward to continuing to add different programs. I can say probably almost for certain we wouldn't have the cultural broker program were it not for this whole initial implementation of the Black Child Legacy Campaign. And since then, we've expanded it. We're now doing, as Executive Director Galello opened with the Safe Sleep Baby 2.0, specifically serving African-American families to provide cultural brokers to do the safe sleep training and education. And our hope is assigning all families with kids 0 to 5, when we have to open, a cultural broker that will begin further reducing entries of African-American children into care. So I say all this because it has been such a phenomenal effort. It's a great foundation. I'm grateful for the partners at Sierra Health, for your leadership, Supervisor Cerna, and for this commission, for all the different programs that you have all supported and invested in along to support this effort. When we give our families resources to meet their immediate needs, when we take approaches that go further upstream and address social determinants of health, which is what this is doing, we save lives, and we will prevent more families from coming to the attention of child welfare. So thank you all for all the work on this.
Thanks, Michelle.
Thank you. Our next speaker is Anthony Ziba. Did I pronounce that correctly?
It's Ziba, but it's okay. It is totally all right.
Thank you. I'm sorry.
Thank you so much, everyone, for allowing me to sit in with all of you. So my name is Anthony. I am the community resource advocate at Sacramento Children's Home Meadowview, and specifically for the African American Fathers Initiative program. And so when I ended up seeing that you know, the perinatal equity initiative or something very similar to that, it ended up sparking of like how like my position ended up getting created when it comes to supporting Black babies' mortality, right? And trying to decrease that number, and by supporting the partners of Black mothers. And so basically, I wanted just basically to hop on. I'm not gonna end up going on a super large rant of like, you know, all these other things, but I did want to hop on because I was like, I'm hearing just a lot of great things, great individuals in this group doing a lot of good work and have the ability to hopefully, you know, connect with African-American fathers or fathers with Black children, because we have started our Black Fathers Incorporated initiative last year, and it's going on through this year. But just trying to get more fathers within the door and just showing that we do exist, that there is a place for you to speak about some of the things that you're struggling with, and also supporting your parenting. Those are the main goals of Black Fathers Inc., you know, in a nutshell. And so what I was going to do, I ended up getting some emails. Thank you, Ms. Carmen. She was helping me out through the chat because I didn't know how to work it. But, you know, she sent me some emails. So Black Child Legacy campaign, you'll most likely end up getting an email from me. And then I've already connected with Ms. Julie as well. But I'm just trying to connect with as many individuals as possible in regards of just trying to get, you know, supporting our Black children, but also supporting, you know, Black fathers or fathers with Black children, you know, regardless of the ethnicity. And yeah, and just bridging that that community, because I know that sometimes as men, we do things on our own. We're like, we got it, we're gonna move on, and you know, whatever stress that I feel like, that's normal. And it shouldn't be a normalcy for us to always feel like stressed out, because that's shows the statistic of us just dying faster, right? And at the end of the day, if that ends up happening, what happens to our families after? So just wanted to bridge that, and I appreciate every single one of you. And I'm just going to go ahead and toss it back to Ms. Carmen.
Thank you, Anthony.
Thank you. Our next speaker is Danielle Abe. And if there is anybody else that would like to address the commission, now is the time to please sign up for that in the Q&A. Otherwise, Danielle is the last speaker.
Hello, good afternoon, everyone. Thank you for letting me have this brief moment to speak. I work with First Five with the Unequal Birth Campaign. I am the health program coordinator for Sacramento County, and I am over the Black Infant Health Program and the Perinatal Equity Initiative. So I want to say that Sacramento County, in partnership with First Five, we began Unequal Birth. It's been 2 years. So at the end of 2019, right, starting the new year in 2020, then of course the pandemic hit and we had these amazing billboards, but everybody was at home. So that's okay. Luckily, we had a social media campaign, and that was, as you can tell from the report, it was really groundbreaking with the impact that it had and with the interaction and impressions. So we're proud of it. Sacramento County, our Perinatal Equity Initiative is among other counties in California, but I just want to say that Sacramento County started ours ahead of everyone else. And so I just am proud of Sacramento County that we get to lead in that way. And what's most important about Unequal Birth is that we're elevating the conversation about something that is difficult to talk about. Today, we've heard of the impact in trying to change birth disparities for our Black families. But I just want to say that what is unique about Unequal Birth is as it continues to call out systemic racism. And it's just not a comfortable casual conversation topic. Let's put it that way. You know, that's going to be something that is hard to bring up or to talk about solutions sometimes, and solutions that are at an upstream level. And so that's really what I wanted to say today, is that we hope to continue moving forward to talk about how can we change the birth disparities with Black moms dying at 4 times the rate and then Black babies at 2 times the rate. And of course, all of the other struggles that our Black families experience. It's not just sometimes, for sure, we want to make sure they have food and clothes and cars and jobs and all of that. But what is happening at the highest levels that lead to these poor outcomes? So I don't have any answers, but unequal birth just is something to start that conversation and to call out on the community, not just the Black community, but every community, every person that's, you know, that's here in our state in California, and ask, how can we make a difference? How can we really, really move the needle and change things? And for me, I'm just passionate about starting at the top. So stay tuned. We do have some strategies that will be taking place in Sacramento County, as we definitely want to be part of the solution. I'm sorry, I want to be part of the solution. Thank you for your time today.
Thank you. We do have a caller, and we're not able to know if they want to speak. So I have permitted them to speak. If they want to speak, they can unmute themselves by pressing *6 and addressing the commission. Okay, I do not see that they are unmuting themselves, so we are done with the speakers.
Great, thank you, Carmen. Linda, any final thoughts you want to share?
I think just that, you know, by hearing the presentations from BCLC and from our partners at ASR, seeing those positive outcomes and the progress that we've made, just the numbers, but also knowing there's people behind those numbers. I think it's just amazing to see that despite COVID, right? I forgot to mention at the start of the presentation that 20 to 21, we went and shut down. It was a COVID year. Everything had to shift so abruptly. And I think it's just a testament to how dedicated everyone is to this work, that despite COVID, BCLC and our funded programs, they're demonstrating not just results, but just a lot of resilience and dedication, and again, keeping community at heart. So I'm proud of everyone that's involved in this work, and thank everyone from the bottom of my heart. So that concludes my presentation.
Great, thank you, Linda. Well, I think I can say on behalf of the entire commission that we are all very grateful for all the terrific work from the partners that have shared in the presentation today, and as has been mentioned by many, everyone that's not here that is on the ground doing the work. And you know, measuring success with lives saved and disparities reduced is I think some of the strongest, most profound data that we can point to in terms of fulfilling our charge to protect some of the most vulnerable people amongst us. So again, I want to extend my thanks. And this is a presentation item, so there's no need for a vote. And with that, we'll move on to our final item of the day. And this is the Commission's opportunity to address anything that might be on their mind. I don't know if commissioners are interested in doing so. If you are, please raise your hand. Okay. I am not seeing any raised hands. Well, this has been a good meeting, great meeting, in fact, especially the last part. I wish everyone well. Please stay healthy, and we look forward to seeing you at our next commission meeting. We are adjourned.
Bye, everyone.